Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Today in Neighborhood Health Watch, trauma injuries and the recent designation of Chippenham Hospital as a Level 2 trauma center. This means the hospital must be ready to initiate definitive care for all patients with general trauma surgeons on site 24/7. Those surgeons must be at bedside within 15 minutes of an emergency. A second surgical team is on call 24/7 and at bedside within 30 minutes. Dr. Raymond Makhoul is the trauma medical director at Chippenham Hospital. Thanks a lot for joining us, and congratulations on the designation as well.
Thank you.
Tell us what this means for patients in life and death emergencies.
Well, we know in life and death emergencies, the time between the injury and definitive trauma care has a major impact on survival. And that's called the golden hour of trauma care. If you can get the patient to definitive care for their injuries within the first hour, their chance of survival is much higher.
Talk about Chippenham being one of 14 trauma centers in the state and what this means for the region.
Well, for the region, we've been a Level 3 center, which is the lowest level, for over 15 years, but now as a Level 2 center, we can provide definitive care for the entire spectrum of trauma patients, definitive care for these severely injured patients.
What goes into earning this designation? I would imagine a lot of resources, not to mention personnel, to have a surgical team, a full surgical team on standby 24/7 on call. That sounds like a lot of resources.
It is a lot of resources, and in terms of physicians and personnel, we have, as you mentioned, 24/7 general and trauma surgeons on site at Chippenham. We also have an orthopedic traumatologist for fracture injuries and so forth, a neurosurgeon who specializes in closed head injuries and neurosurgical injuries, as well as facial plastic surgeons who are experts in this field.
And what about geriatric patients and the special needs of that group of patients?
Well, one particular area we're interested in is the geriatric trauma patients. As you know, that's one of the fastest growing portions of our population. And this is a population where often you have falls and injuries resulting in hip fractures, rib fractures, and so forth. And we have a multidisciplinary approach with specialists within surgery, medicine, orthopedics to take care of these patients, get them to surgery, and get them back home as soon as possible.
Right. Awesome. Thank you so much for sharing all this information with us. Again, congratulations on your designation.
Thank you.